Effective therapeutic modalities for heart failure with preserved ejection fraction are lesser than those available for heart failure with reduced ejection fraction. All the same, prevalence, morbidity, and mortality for HFrEF are not lower than that of HFrEF. Ongoing search for therapeutic options has led to the development of interatrial septal devices to decompress the left atrium, which are still in investigational phase. A unidirectional left-to-right interatrial shunting device was initially tested in patients with HFrEF as a safety and proof of principle cohort study. The device could be successfully implanted in all the 10 patients enrolled with no device or procedure-related adverse events. Transesophageal echocardiography at 1 month showed patent shunts with no thrombosis or migration. NYHA functional class improved in all but one. No patient was admitted to hospital for worsening of heart failure. One patient died at 2 months with incessant ventricular tachycardia and heart failure. Reduced lap HF was a multi-center, open-label, single-arm, phase 1 trial of another type of interatrial septal device for HFpEF. 21 centers across 2 continents participated in the trial. Successful device placement could be achieved in 64 of the 68 patients enrolled. No patient had a peri-procedural or major adverse cardiac or cerebrovascular event or need for cardiac surgical intervention for device-related complications during the 6-month follow-up. At 6 months, 52% had a reduction of pulmonary capillary wedge pressure at rest, while 58% had reduction during exertion. 39% had reduction of pulmonary capillary wedge pressure at rest and during exertion. Sustained device patency was also confirmed at 6 months with a left-to-right shunt of 1:1.27. 1-year outcome of the trial was reported later with sustained improvements in New York Heart Association functional class, Minnesota Living with Heart Failure score, and 6-minute walk distance. Survival at 1 year was 95%. Echocardiography showed a small stable reduction in left ventricular end diastolic volume index with a concomitant small stable increase in right ventricular end diastolic volume index. Reduced lap HF1 was a phase 2 randomized sham-controlled trial. Sham procedure was femoral venous access with intracardiac echocardiography but no interatrial septal device placement. Participants and investigators assessing the participants during follow-up were blinded to treatment assignment. There were 22 patients in each group. At 1 month, those with interatrial septal device had significantly greater reduction in pulmonary capillary wedge pressure during exercise. There were no peri-procedural or 1 month major adverse cardiac, cerebrovascular or renal events in the device group. 1 event of worsening renal function occurred in the control group. Authors suggested further evaluation for sustained improvement in symptoms and outcome. Reduced lap HF2 was a pivotal international multi-center randomized controlled trial of an interatrial septal device. Patients will continue to be enrolled in an open-label reduced lap HF4 study at existing trial centers. Reduced lap HF2 randomly assigned 314 patients to the device group and 312 patients to the sham procedure group. This was a neutral trial in which there was no differences between the groups in the primary composite endpoint. There was also no difference in the composite safety endpoint between the groups. Primary endpoint was a hierarchical composite of cardiovascular death or non-fatal ischemic stroke at 12 months, rate of total heart failure events up to 12 months, and change in Kansas City Cardiomyopathy Questionnaire overall summary score at 12 months. An editorial comment on the report was titled, Reduced lap HF2 in Interatrial Shunt Trial, Neutral but Necessary. Now we will have to look out for the results of open label reduced lap HF4 study. Relief HF trial of another interatrial septal device is expected to be completed in October 2023. It is a trial enrolling heart failure patients irrespective of left ventricular ejection fraction. First set of journal references. Second set of references. Third set of references. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.